The first question is, how does care for the uninsured and underinsured affect Tennessee?
Well, if you look at the uninsured and really the uninsured rate in Tennessee, estimates vary, but we're looking at somewhere between 600 and 700,000 Tennesseans without health care coverage. And so what that means is that they don't necessarily have a regular system of care. So they might seek care episodically through the emergency department. Some may have established relationships with clinics for primary care or the health departments for primary care, but there's not a comprehensive system for those folks that do not have health insurance. They're not monitoring their care often. They often don't get the preventive services that those of us who have access to comprehensive coverage have. And so when a problem emerges, which may have been previously undetected, often it's worse. And so, then it can become a catastrophic situation. So, just having access to a regular place of care, and that's what insurance affords those of us who have comprehensive coverage. The other issue I would say is affordability is the other issue. That's primarily the reason why many folks don't have access to care, because insurance is out of reach. It's unaffordable. So just being able to tackle that issue is a big one, and I think that's a national issue. That's not just a Tennessee issue.
You are a great example of what Nashville government can do to meet some of these challenges, but can you talk a little bit about Cover Tennessee and what Governor Bredesen is doing to try to offer insurance to the uninsured?
Sure. Well, Cover Tennessee is a family of programs. It's an umbrella term that we use to describe 4 programs for the uninsured. 3 are insurance products, and 1 is a pharmacy assistance program. And what Governor Bredesen's goal was to provide some options for Tennesseans that didn't have options in the past. Even when TennCare was at its most expansive, we still had about 600,000 Tennesseans who were uninsured. And most of them, the majority of them, were working, and were working full-time, and they still didn't have access to comprehensive coverage. So what Cover Tennessee provides are some options. We have a program called Cover Kids for children whose families qualify based on income. We have a program called Cover TN, which is for working adults who are working for a small business who might qualify based on the characteristics of the business, or they might be self-employed, or they could be working for a large employer who doesn't offer health care coverage. So those are 2 cornerstone programs. And then we have a small but very important program called Access TN, which is for individuals, adults, who cannot purchase comprehensive coverage in the commercial market due to their health conditions. So they would be considered by the insurance market as uninsurable. And so Access TN provides a guaranteed issue program for them. And then the pharmacy assistance program I mentioned is for individuals who don't have access to prescription drug coverage.
How do you see Cover Tennessee and Cover Kids as solutions to the crisis of treating the uninsured?
Well, again, having a health care card is that sort of magic entryway into the healthcare system. And so Cover Kids provides comprehensive coverage, and for those who qualify, there's no premium. So families can be assured that their children have access to primary care and specialty care, immunizations, and dental benefits, vision benefits for their children. Cover TN is a very affordable product. It is not comprehensive. It's a limited benefit plan, but it provides most of what most people need and is very affordable. If you look at all the research out there, and in fact, the Kaiser Family Foundation just came out with a recent study last week that showed that a large percentage of uninsured adults say that $50 is the most that they would be willing to pay for health care coverage. So affordability is key, and what Cover TN tries to provide is an affordable product And again, not comprehensive, not the Cadillac of coverage, but to provide most of what most people need. And most importantly, to provide a way to connect individuals to the healthcare system. So again, primary care is essential there. We have no deductible in that program because we don't want to put up a barrier for people to seek that first doctor visit, for example.
What is Cover Tennessee's greatest challenge, and what are you currently doing to combat this challenge?
Well, it varies by program. For Cover TN, which is the program for working Tennesseans, we have so many Tennesseans that are now losing their jobs. So again, affordability is an issue. We created a new category for that program that we call Tennesseans Between Jobs, which recognizes that not everybody is going to be employed at the moment that they need health care. So previously we had a requirement that someone be employed to be eligible for the program. And we dropped that requirement, recognizing that in this economy, people are going to be transitioning between jobs. So that's one of the things that we've done, and we've kept the premiums low. We had no premium increase between 2008 and 2009. So we've tried to keep the product very, very affordable.
What do you think has been Cover Tennessee and Cover Kids' greatest success?
Well, for Cover TN, I'll point to one of the statistics that we have about the employers, for example, that participate in our program. The governor really wanted to create a product that met an unmet need out there. In other words, employers were not able to access the commercial market due to small employers due to the high price of health insurance. Fully 75% of our businesses that participate in the program had never offered coverage to their employees. So this was the very first time that they were able to offer something for their employees. So we're really proud of of that achievement. On Cover Kids, we started the program 2 years ago, and we are about 2/3 of the way to meeting the unmet need in terms of health coverage for kids that qualify for our program, which we think, for a brand new program is pretty phenomenal. So we're really pleased with that. Now with the economy right now, we're seeing more and more children and their families being eligible, so that the number of eligible children is going to grow. But in terms of our uptake in the program and our outreach in the program, we've been very successful.
Recently, a member of Congress from Tennessee said that he considers health care a privilege and not a right. Do you think that national health care reform is needed for Nashville and Tennessee, and if so, why do you feel that way?
Well, I do think it's needed. I think health care is a national problem. If you look at the number of individuals that do not have health coverage in this country, and it continues to grow, it is really becoming not just an issue of a social issue in terms of providing some of the basic necessities of life, but it's also an economic issue, and it's a competitive issue. I think we've heard the statistic of GM and how much money of each car, how much in terms of dollars of each car goes into health insurance. In the state, for example, for the health insurance that I enjoy, the state pays for every state employee almost $9,000 a year in health coverage, and that's for the average, which includes family coverage. That's a huge number.
Yeah.
And so, when you look at the cost of care, it becomes a competitive issue. The ability to recruit talent to businesses and industries, the ability for people to move from one job to another. I mean, think about how many people are now feeling stuck in a job because of health care. They're saying, well, I'm keeping this job because I don't want to lose my coverage. One other thing to point out about the Cover TN product is it's portable. So the individual actually owns the coverage, and they can move from one job to another and take it with them. So, that's one of the issues I think we're facing, is that it is not just an issue of basic need that we all have to be healthy, but it's also an economic imperative, I think, and a business development imperative.